Hello, I'm Dr. Deborah Sunbeck. I'm the psychologist who created Infinity Walk back in the mid-1980s. Infinity Walk method is a therapeutic process that's used in healthcare and education to teach children and adults how to build or regain essential foundation skills. A non-clinical version of Infinity Walk can be successfully facilitated by trained teachers, parents, and other caregivers. For instance, this preschooler is experienced in playing a learning game version of Infinity Walk. Here she's infinity walking in a figure-8 pattern while attending to and interacting with an adult who's reading to her. Her advanced Infinity Walk training developed her ability to use looking, listening, thinking, and speaking skills while infinity walking with coordination. This ballerina volunteered to demonstrate infinity walking with the added challenge of looking at the video camera. Notice how walking in the figure-8 caused naturally occurring left and right directional shifts in foot placement, ankle rotation, neck turning, eye tracking, and much more. These smoothly alternating shifts in the use of the left and right side of her body are orchestrated by her brain's precisely coordinated shifts in neural activation between her left and right brain hemispheres. Infinity walking while looking steadily at an object without breaking your gaze or losing your coordination or balance is an advanced skill that can be developed with practice. This illustration shows how to use a television to provide a properly located visual and auditory point of interest for practicing Infinity Walk when you're alone. As the Infinity Walker moves between the clockwise and counterclockwise circles, the eye and ear that faces the television automatically alternates between the left and right. To advance your Infinity Walk training, a social or learning environment is often useful. Notice here that this young student is fully engaged in a visual task. It's typical for arms to stop swinging when challenged with a new mental task. Here, the same boy is showing natural arm swing while looking at and listening to a familiar storybook. For many good reasons, Infinity Walk facilitators don't point out the absence of arm swing or lack of eye contact to the novice Infinity Walker. Doing so can ruin a student's enjoyment for Infinity Walking. Increased coordination and ability to focus or split attention develops naturally as the more experienced Infinity Walker becomes relaxed and proficient at multitasking while Infinity Walking. A skillful Infinity Walk facilitator will help children progressively advance many essential foundation and learning skills without them ever losing interest in playing Infinity Walk as a fun game of how many things can you do at once. Adults also take a turn when playing Infinity Walk as a game. This allows them to show children how to advance their Infinity Walk training without needing to point out what a child has not yet learned. Children tend to want to try the same challenges as other Infinity Walkers. This mom did an extraordinary job of helping her daughter practice the Infinity Walk method. All the good sense that excellent parents and teachers use when motivating and teaching their children also gets applied to facilitating the Infinity Walk method. Here's the results after 8 weeks of combined home practice interspersed with 6 therapy sessions. Not only is coordination and balance much improved, but this girl is multitasking by splitting her attention between Infinity Walking and verbalizing a cognitive task that requires mental concentration. When Infinity Walk is done from a seated position, it's called Infinity Riding. This infant is demonstrating how much upper body rotation can occur while infinity riding, just by having her attention drawn to a point of interest. The same can be done from a wheelchair. Therapists often combine infinity riding in a wheelchair with reaching, throwing, and catching exercises. There are many ways and reasons to infinity ride instead of or in addition to infinity walking. This infinity rider is training for the Special Olympics while also expanding her therapeutic horseback riding practice to include the infinity walk method from a seated position. Here she's looking at and conversing with a group of spectators who are splitting her attention by adding mental and verbal challenges. Balance and preventing risk of falling is always prioritized when therapists make decisions about whether and how a person will benefit from the infinity walk method. There are many clinical modifications available, including using a therapeutic handrail designed for safe, continuous infinity walking in a figure 8 while adding other multitasking and split attention skill practice. An Infinity Walk medical modification form is available as a free download at www.infinitywalk.org. You can also learn more about the medical and educational uses of the Infinity Walk method at this official Infinity Walk website.